On any given day, some 800 inpatients, 800 outpatients, and over 240 emergencies are cared for in one of Ireland's busiest hospitals, Cork University Hospital.
It will take just one patient to come in. That just completely stops you and reminds you that, whoa, this is somebody's worst day of their lives.
On any given day, some 4,000 staff come to work here, a place where life-changing decisions are made every minute, and every decision counts.
Because I see a lot of sadness, I get great pleasure giving people the good news when I can.
Here I am, hold my hand.
You're having a heart attack.
Filmed using 27 cameras, following patient journeys across the hospital. Each story in this series was captured in just one single day. Together they tell a bigger story of any given day.
I'm here for a long haul. They're not getting rid of me.
I just broke down. What is going on?
I'm getting the chance she didn't get, so I have to grasp it. A good shift is where you come out the door happy, thinking, I made a positive difference today. And that's really it.
Message received, thanks. Look, I am getting absolutely hammered. Hi, it's Lynn over in A&E. I'm just wondering, is that bed ready yet? You don't have no beds, but like 4C are taking patients off you. They not gone yet? Yeah, does that mean you have one space? Yeah, so does that mean we give it 40 minutes, 20 minutes, 30 minutes? Okay, look, it's 1:30 now. Will we be over by 2:30? Will the handover and the patient be up at the ward and everything like that? Fabulous. 9.
Okay, speaker and speakerphone.
Yeah, sorry. So we have Madison.
A 4-year-old girl, Madison, is being rushed to hospital by ambulance. She is suffering prolonged seizures.
Across in your airway. Robin, are you okay on drugs? Yeah, I think that would be an antibiotics and fluids.
Yeah.
You might need a second person.
Emergency consultant Rory O'Brien is leading the team in resus.
Rachel, I think access is going to be the thing. With a sick child, you need a lot of people, but you want things to be calm, you want things to be measured. Amy, do you mind doing assessment? You want to be making the best decisions. So everyone who's... Prolonged seizures we know aren't good for you. 15-minute seizure had a further 1-minute seizure. The oxygen going to your brain, which is what you're trying to protect, may be reduced, which can affect brain metabolism. So we need to stop the seizure.
Madison's mother, Shannon, called the ambulance.
I know what seizures are like. I just felt there was something just different about this one. We gave the rescue medication after 5 minutes, which I administered myself, and the jerking of the body stopped. But then the lips started twitching and the eyes were starting to roll into the back of her head. And her breathing is starting to be affected, which had never happened with Madison before.
She had a seizure this morning at approximately 10 to 9, lasting 16 minutes. When we got to her...
Madison's condition has continued to deteriorate en route to hospital. Her breathing is compromised.
We got to her with a heart rate of 144.
She looked lifeless, like as if she was gone. Just see that, like when they're pushing the bag down and your child is like unresponsive. It's horrible.
That's clearly a major concern, because I'm wondering, is this a problem with her airways? Is that why she's not breathing appropriately? Is it a problem with her lungs? Is it a problem with her circulation system? Or is it a problem with her neurological system, with her brain?
I thought we were never going to get there.
Yeah. En route here, she's had one more seizure en route with right focus there, also tonic, her limbs stiffened also.
Yeah. Hey Madison. Hello. Hello. Serious. Stiff there.
We're just looking for an NPA, the nasopharyngeal airway for a
I
child.
think she's still seizing, to be honest.
Yeah.
She's a lot stiffer on this side there.
I'm giving her jaw first, so she's not doing much.
I'd say we give another Larals there. I think she's still seizing. The child who's having a prolonged seizure, you're fundamentally worried about any primary or secondary injuries that would be happening to their brain. Do you think she's seizing? There is a very high chance that this child will need to be placed in a ventilator while we give her very potent medications to help stop the seizures.
As the resus team work to stabilise Madison, her parents and grandparents are waiting in the relatives' room.
I don't know.
A nurse came out to us and said, look, we're going to have to prepare you for the worst.
She probably has been seizing then.
To hear that then, it just broke my heart.
What are her eyes like? Is she? And they're not fixed. They're not. Yeah. We're doing a blood pressure there. Don't feel too cool. And she was stiff on the right side, so, and eyes were slightly deviated to the right, so probably seizing. There was uncertainty as to whether Madison would need to be placed in a ventilator, so you do need to introduce that idea early on, because you have to prepare Madison's parents for that very possible outcome.
I just said to Mum, I can't lose her. I can't lose my child.
Howard Grice has motor neuron disease. He is in CUH today with his wife Yvonne to check the progression of the condition.
My name is Howard Rice. I was born in Sheffield, Yorkshire in 1966. I moved to Towering, County Cork in 1994 with my partner Yvonne. I have motor neuron disease. It has affected my speech and swallow, amongst other things as well.
Howard is treated by a multidisciplinary team, including respiratory physiotherapist Kevin O'Sullivan.
I've really been without speech since about a year and a half ago, so I use this app to communicate now.
From your point of view, how is the breathlessness?
A recording of my speech was made when it was deteriorating. What you hear now is a repaired version of my speech. It can be frustrating, but you get used to it.
You've done this before, yeah? Big deep breath in, coughing into the mask. And we're going to just see how strong you are. We'll be doing 3 or 4. Go on.
I'll turn away from you, otherwise I'll be laughing and not about to do it.
When Howard laughs, his whole body would shake, his face would just erupt, and you'd laugh with him, because you don't know what he was laughing at, but you'd laugh with him, It's difficult watching him and knowing what he was like before. He was very talkative. He was the life and soul of the party. He'd be the first in and the last to leave. just a top guy,
Recover, big breath, cough.
Motor neuron disease, it's a severe degenerative disorder of the nervous system, and we don't unfortunately have a cure for it. We do have limited medical therapy which is shown to slow things down, but unfortunately it doesn't stop the disease from progressing. MRI cervical spine identified a disc at C5-6, but his symptoms were outside.
Consultant neurologist Aisling Ryan has been treating Howard since his diagnosis.
It's always difficult to communicate the diagnosis of motor neuron disease to a patient. You never get used to it. You try to be there for that person and be the go-to link or be the coordinator for their care for as long as you can.
So a small dip today compared to the last time you were in clinic, okay?
The most common cause that people die of finally in motor neuron disease is respiratory failure. And even if your lungs are okay and you've never smoked a day and you've perfectly healthy lungs, we still need innervation of our chest muscles to actually move our rib cage up and down, and that slowly over time fades for patients with motor neuron disease.
and relax. Okay? I know. Take a breather. Give a minute. You're going to have to be doing this another 2 or 3 times as well, okay?
And he likened it to a thief taking from you the whole time. The thief has got his hand in your back pocket and he's taking everything. He's taking your speech, your mobility.
Better.
It's like a gradual chipping away of the person that you are.
I had always been a very active person and felt the threat of losing my ability to continue living as I had been accustomed to would be a very difficult challenge. A lot of negative emotions, anger, fear, sadness, worry, it's a head wrecker.
Super. Well done.
Good job.
Oh. Okay.
And there's your other soft collar then as well, just so you have it.
And that's our number on that
Yeah.
one, isn't it? Yeah, that's fine. Just so you have it, okay? Alright, we'll see you again, okay? And we'll be in touch. Okay?
Bye-bye.
Good stuff.
Are you from Limerick?
No, I'm from Cork.
I am from.
Why would you think I'm from Limerick?
You have a features of a
Could you? Do I?
Yeah.
Thanks. I don't know, is that a compliment or not?
Girls are the best looking girls in the country.
Who?
Limerick ladies are the best.
Oh, so it's a compliment.
Yes.
Thank you very much.
Yeah.
Dr. Jason Vandervelde is on duty in the emergency department and also on call for emergencies outside of the hospital.
The golf car 7 minutes out though. I've mentioned cold and stiff, but I'm sure it's beyond any help.
Roger, the golf car's on its way. That's perfect. Thank you very much. Dead.
Cyclist George Fuller has dislocated his kneecap. Jason will seek to realign it.
I stumbled into pre-hospital care. Don't know if I'll do it again. I'll probably be a vet in another life. Alright. I was a lifeguard, beach bum, didn't do great at school. Joined the ambulance service, really enjoyed it. Absolutely loved being a paramedic.
I won't go with it. That'll be sore.
Use the top finger on the top to actually strengthen it, and I'm going to not do anything to you for 2 minutes. I actually want you intoxicated, and then I'm going to straighten it. Got injured, but I still wanted to carry on, and so I suppose that injury in myself enabled me to go to college, study further, and so I went to medical school. You can do bigger breaths than that. I think it's that community of pre-hospital care that's so special. Your head will swim, that's fine. Right? I just want you completely intoxicated. Deep breaths. Deep breaths. You're doing perfect. Well done. You're doing perfect. Deep breaths and relax yourself down. There we go. Well done. Deep breaths. You've done magically. Keep going. Just turning the kneecap the right way around. Well done. You've done brilliantly. Okay.
Nice
All
one.
straight.
Just like an in.
Well, no. Yeah.
Thank you.
I'm out of here, lads.
Jason is dispatched to a serious incident near Fermoy. A man has been kicked directly in the chest by a racehorse.
A patient is coughing and spluttering, making loud grunting noises there, but is conscious. Crew ahead of you. 2 minutes just.
Bottom line is people do not get injured at the front door of the hospital. You get ill or injured at home, on the farm, in the workplace, on the road. And our role is to bring the expertise of the hospital to where you become ill or injured to slow down, hopefully halt the dying process. I see a man in a farmyard, he's after being kicked by a horse. The big worry, you've taken a full force of a massive animal kicking you into the chest. That energy has to go somewhere. It hits your chest wall, bruises in the lung, bruises to the heart. I have to assume the worst at this stage. Yeah.
Young and feisty.
So it was just a straightforward kick into the chest, and you didn't get thrown backwards? You did?
He did, up against this wall here, he said.
Okay. And did you hurt your back at all? You did? Okay. So you're in charge of your own pain limit? You've got to be very, very vigilant that they haven't damaged the spinal cord. Bones can break, they can break all the way through to your back. Any pain into the chest? Oh! Yep, that's the one.
He was in a lot of pain.
Nice. The ground here is not going to make it stable. Hang on. Hang on. Right, I'm going to keep on following.
And the horse was still standing between me and James, so I couldn't get to him. All I could think about was what damage is after being done. And when I heard it was in the chest, all I could think about was what's going on inside in him right now.
Get you in the ambulance with a much better look at you.
It won't be far off it, so.
Not far off it.
Just go with it.
Okay, I'm just going to get some skiv. James? Let's have a quick look at your lungs, alright? Just while you're here. There we go.
When you see someone you love lying on a stretcher and they're pinned down to it and their eyes start to roll and the colour drains from their face. Is he bleeding internally? I didn't know what was happening. That's when we all got really frightened.
There's a few months now, Dave.
4-year-old Madison was rushed to CUH earlier today. The team have successfully stopped her seizures, but she is yet to regain consciousness.
We just wanted her to come around, like for her to open her eyes so she knew that we were there. I'm going over this side, I want to hold her hand. Probably. Can I hold her hand? Is that okay?
Yeah, sure. I'm holding because it was a bit cold, so warm her up. Yeah.
Oh, she is cold. There's one thing seeing her have a seizure, but to see her the way she was, like literally out cold from being given medication to keep her comfortable. And we were just talking to her and like saying, come on baby, like you're okay, like we're here. And you just want to be with your child and take her place so she isn't going through what she's going through. It's very hard. It's very, very hard. She's been fighting since the day she came into this world. We never thought she would do anything that she's doing like now. But Madison, like, she just surprises us every day with how like strong she is, and we're just so proud of how far she's come. I was only 19 when I found out I was pregnant with Madison. I was happy, sad, scared. My partner James found out I was pregnant 3 weeks after meeting him. I was like, oh my god, like does he want this? Like, is he going to walk and leave me on my own? But he didn't. He said we did this together and there's no going back, like we'll do it together. The birth was hard, but it was beautiful, and I was just in awe. I was so happy that my body was able to bring Madison into the world, and that I had James's support as well. And then everything changed. We went in with the consultant and they said Madison has been diagnosed with DYRK1A syndrome. We were like so worried. I was like, what is wrong with her? Like, she's the only child in the Republic of Ireland that's been diagnosed with it. Like, I think there's like 30 something kids in the whole world with it. Like, it's very rare. Madison can't talk, she's autistic, she's epilepsy, feeding problems, walking problems. There's so many to do with her disability. Like, she suffers from constipation, reflux, there's so much.
I weigh very heavily on how the parent is viewing their child. They'll know the condition better than I will. They'll know the nuances.
Madison is extremely ill and will need to be closely monitored in the coming hours.
Then you can go suspect it.
She's now getting oxygen to her brain, but things can change at the drop of a hat. Madison can start seizing again, and her oxygen levels can start going down again, and her breathing can become depressed again, so you maintain a holding pattern.
James is he's a very caring person, very kind. He said, and no matter what, we'll be the best parents and show our kids like what love is like as well, like show them that like no matter what, we're always going to be by their sides. It is hard, like it's very challenging, and it's like it's around the clock care, like it's constant medications, dosage change, hospital admissions.
They're entrusting you with their child, so at this moment they are saying, you need to come in, you need to help us. I couldn't imagine what it's like. It's that lack of control, having to give control over to the team. It must be a very uncomfortable kind of feeling for the family to do that.
We're living it every day. This is what our life is with Madison every day.
CUH, it's like a big city with little villages, you know, each of our own little set group that we work with, but then we kind of call to the neighbours every now and then for the bottle of milk, you know.
You okay, James?
Yeah, the bags are outside.
Where's my Niamh? Where's Niamh? Niamh's outside there.
49-year-old James Fenton was kicked in the chest by a racehorse. Emergency doctor Jason is concerned he may have life-threatening chest and back injuries. Paramedics are preparing to move James to CUH.
Two specific points thoracic spine, upper thoracic spine and lower thoracic spine, and he's also tender into the lumbar spine. If you have a chest wall injury, excruciatingly painful, because every time you breathe, it's pain. I have not got a CT scanner that's going to tell me definitively that those lungs are not contused or that heart is not bruised. And so my first priority is just getting as much analgesia as he needs to enable him to breathe effectively.
Everyone's
there looking after everyone.
I don't know what they're after giving me.
Ketamine.
I'm on fucking cloud.
Oh, that's good. There's no pain, so.
No.
Alright.
He was on cloud 9. I think it was the results of the ketamine in his system. He didn't feel like he was here with us. He proposed again.
I love you, and we'll get married. We'll get married next week.
Really? Yeah.
Yeah.
I was 8 months pregnant, trying to keep calm.
Where are you going?
I'm going to follow you into the hospital.
What hospital?
CUH.
I was just trying to think, how am I going to juggle all of this? And I'm going to be on my own doing all of it. What if this is more serious and that the ketamine and all the other drugs he's on are masking what he's actually going through?
Howard has motor neuron disease. Following his respiratory assessment earlier, he and his wife Yvonne are waiting to see consultant neurologist Aisling Ryan.
Hi. How are you? Come on in. Take a seat there, Howard. Can I just get a sense of what you can do there? So just arms up if you can. Good. And keep that up against me. Good. Keep that up. Good. Maybe a little weak there. Push down for me nice and strong, and push down nice and strong. Okay, good. He still has quite good strength in his arms and legs, so he's walking, he's able to be independent in many aspects, but unfortunately that will change over time, and then it's dealing with the challenges that brings up, and how is he going to manage, is he going to be able to walk around his house, is he going to be able to dress himself, etc., etc. And this time, pull towards you, pull in towards you.
I get fantastic support from Yvonne. There are things I can no longer do for myself that she now helps me with, and she's had to handle my frustrations. I'm fairly good at releasing emotion. I don't like bottling it up. Better that it comes out.
And just the grip strength, just squeeze me tight there, okay, and squeeze tight here. So yeah, that's a little weaker on that left hand, isn't it? How's the strength in the leg?
I just like to look after him. You know, it's not a big deal. It's just, that's what you do for somebody that you love, I think. We have an issue with the wedding ring. The fingers have swollen, and we can't get it off. It looks to me like it probably needs cutting off.
They will have a ring cutter. They always have one down in the emergency room because sometimes this happens. I mean, it's a sort of a difficult thing to, you know, cut the wedding ring. Do you want that done today if we could organise? Not really. Do you want to think about that a little bit?
It's nice to just sit and be together and hold hands. It's just a bit of closeness amongst all the hustle and bustle. That's a precious moment.
Maybe the next time you're coming, or if that's too far away, we can get it done in between.
We all know how it ends, but the challenge is to make the most of the remaining time I have. Despite my deteriorating health, I still feel very fortunate. I have a loving family. I have a lot to be thankful for. I don't think about what I may miss, but concentrate on what I have enjoyed over the last 20-odd years with them. Life's too short for all of us to be worrying about how it all ends. The trick is to enjoy each day.
Was he playing GA or sports? So that was sports day. Everything, yeah. Tag rugby, I think. First and last time, I think. Yeah.
We're giving you more medication there now, Jude, okay?
It's almost done. It's almost done. Well done.
64-year-old Tim Murphy has advanced lung cancer. Today, doctors will attempt to surgically remove the cancer in a bid to save his life.
That'll be 40.
The consultant came in and told me that Tim had a tumour on his lung and it was cancer. I've had 2 uncles that actually died of lung cancer, so I just thought, oh God, here we go. He's gone. See, number 40. I just remember Dr. Collins's initial words were, oh, it's a big boy, was what she called the tumour.
What's the date of birth? 19th of July, 62.
I first met Tim in the autumn of last year. We would have discussed his case in our multidisciplinary team meeting, and we would have looked at all his images and made a decision that actually pre-surgery chemotherapy with immunotherapy, I suppose a regimen that we call neoadjuvant, was the right way forward for Tim. And the whole purpose of that would be to shrink down the cancer, because as he currently was with his diagnosis, he probably would have lost his entire lung if he had gone straight for surgery.
Great. We might have a quick look at the board then.
When I walk through the hospital, there is a professional persona that kicks in. But one of the hardest things that I do is when I, have patients and have to tell them that this cancer is going to shorten their life significantly, that they are, going to not be around for their children or their grandchildren.
Thanks, Mohammed.
We give people hope, we buy people time, but it is emotionally very draining. It can be really hard to shake it off at the end of a day and to, head home and pretend that I just, put in a 9 to 5.
Okay. So I scamming on
Following a regime of chemo and immunotherapy to reduce Tim's tumour, surgeon Kishore Dodakula will attempt to remove his cancer completely, also hoping to save his lung.
Okay. So if we look at the differences, I suppose, in where we were after 12 weeks of treatment, there's obviously been significant change. You can see it's a big cancer here, and then, obviously much smaller now.
You never know till you really go in, but I'll try and save, but yourself, unless we go in, we won't know.
Do you smoke?
No.
So he's off them now 2 years since the 14th of April. There was a point, and now Tim doesn't know this, but I felt very angry at him. Like initially it took everything in my power not to say, you were warned. He had this god-awful cough. Sometimes he'd nearly choke with it. And I just couldn't understand how he carried on smoking. But you just have to try and think of where do we go from here.
So we'll start the pre-op. They'll check your operation site later on.
My operation what?
Operation site, just so we always mark where we're going to operate.
That's handy.
Make sure it's the right side,
okay,
exactly, yeah, it's just a check. Do you know the reason for your admission?
Yeah, lung cancer.
Lung cancer, and you're going to, this is a surgical ward, so you're going to have surgery on your left lung.
Yeah.
Is that okay? And hopefully they'll be removing
Hopefully.
the tumour, yeah, okay.
Yeah.
To be told that the tumour had shrunk by half was huge. We knew then that he could go for surgery. We just had to see what they could do.
Who's next of kin?
Okay.
Okay. Is it partner, wife, or?
Partner.
I asked the same question myself.
Not yet.
You're
later this year.
Yeah. Okay, brilliant. Congratulations.
What?
The goal is to get him to surgery. So being able to, I suppose, shrink down his cancer and have it then removed by a surgeon is the best outcome, and that what we could hope for Tim.
Let's sit down here.
Good. Ah, no, please sit down. Sure. It's all right, yeah. How are you feeling?
Great, brilliant.
Good. Day has come.
Yeah, I heard so.
Yeah. So heading into surgery fairly soon.
Yeah.
The chemotherapy and the treatment. You feeling?
Yeah, I feel good. I didn't suffer badly with it at all.
Yeah.
Just pins and needles, tiredness.
Yeah, beat you up a bit, in addition to beating the cancer up a bit.
Yeah.
That's the plan. Did that though, didn't it?
Did you?
Yeah.
Did a big job in that.
Yeah.
Thanks be to God.
Good. The big fear for us is that, when the surgeon goes in to operate, that he doesn't get it all. And Tim might end up losing the whole lung in order to try and get clearance. And of course, there's risks to surgery. I mean, having a portion of your lung removed is not without, potential for potentially devastating impact.
It's just that.
So, yeah, it is what it is.
I know.
We're getting done what we're getting done, So can't do much more about it,
The team has stabilised Madison following a series of prolonged seizures earlier today.
Just ring me.
Madison suffers from a rare genetic condition called DYRK1A syndrome.
We always said from the start when we found out Madison was sick, no matter what, we'll deal with it together as a family. I do get lonely at times, but then I have the support of my mother, my father, my partner James, my siblings, his parents and his siblings. So we can just ring them, but it's very hard to kind of explain how you're feeling.
This is her dad. This is her dad, James.
I'm constantly blown away. Just the level of care and dedication that parents have. Their whole lives have gone down a path they didn't think they would go down, but you never see regret. You only see love, and it's mind-blowing.
Madison will be admitted to the paediatric ward so she can continue to be closely monitored.
She's just a lot more stable now, so we're happy that we're going to bring her back and then just kind of wait for her to come around. We'll keep an eye on her. And then
Madison does have needs, and that's just the way it is, but she brings so much happiness to all our lives, and everyone is so happy. She puts a smile on everyone's face that she meets. Just looking forward to the future as our family.
James was kicked in the chest by a racehorse earlier today. Pre-hospital physician Jason Vandervelde is concerned he may have significant injuries to his chest and spine.
I'm
been there with horrific trauma when it's your own family member. You know, my son fell off the banisters, you know, from the top story down to the bottom story and literally went splat on the tile floor below. Having to manage that will always stick with me. I live rural. I live 50 minutes from the hospital. So I had to switch into clinician mode. Did not have any other option. And the one thing that I've appreciated is my colleagues, the CUH family, because I was able to hand over care with my severely traumatically injured 5-year-old. I knew he was in completely safe hands.
He's multiple crepitus down the left hand side of the chest. He's had 1 Pentrox.
Before James can be sent for a vital CT scan, his pain needs to be controlled.
Alright, we're just going to get some local anaesthetic and we're going to get some local anaesthetic and try to take the pain down for you. Yeah. It's left side that we're blocking. Alright. I seem to be very calm on scene, or my parents on scene is very calm, almost non-empathetic, but actually I've been there. And I know that the most effective way of managing somebody who's traumatically injured is to push emotion to one side and focus on the clinical, on what really matters. A lot of this is just the ketamine because you don't feel in control. And yourself being the boss, normally at work, you're always in control, aren't you? Is that
The
right?
day before James's mum had passed away, to see a completely opposite side of James being so vulnerable, so upset that his mother had passed away, then in so much pain from getting a kick from a horse, all in the space of 24 hours, it was very, very hard to know what to do or how to make things better and how to be there for him.
We'll get him checked in there for you.
Okay. I know you're hurting a lot, so what I'm going to be doing is getting a bit of local anaesthetic just into around where it hurts the most. I can see the bruise coming up now.
My mother died just then.
I know. Yeah.
And I want to be there for the funeral.
I think just one thing at a time, alright? Because in fairness, you took quite a belt off that horse, right?
It's not fucking hot in there, so
No, you're definitely not hot enough to be in hell. Sometimes you call this place hell, but it's not. It's CUH.
I'm a paediatric nurse by background. I started off actually as an actor over in the UK. I'm from Wales originally, and I went into hospital as a play specialist, working with puppets and children. Funny really is that a lot of the TV stuff which I did as an actor was hospital based, like I was extras in Casualty and a few other hospital based programs. So when I first came to work in hospitals over in the UK, I didn't actually like things like injections and blood, so I just used to pretend I was back on the set of Casualty.
Eugene O'Leary has been brought to the emergency department following a chainsaw accident.
You were cut in the hedge, were you?
Yeah.
It needs a few stitches, doesn't it?
I would think so, yeah.
Yeah. How many cuts are there? So thumb, index. You wouldn't do it with a knife next time, would you? Eugene's hand was quite simply a mess. If you have a wound there, bacteria in that dirt love blood and they just grow and grow and grow. Ah, it's all a mess, isn't it? But there's still leaf on that. Leaf. There's still leaves in you.
There'll be heads growing here shortly.
I flicked in there. I think one of the most mangled hands now that I've had to try and put back together in a long time.
Good man.
Do you have any kids?
I'm not married.
Right. Doesn't mean you can't have any kids.
No one would have me.
No one have you. You escaped. You want to be confident with the patient And I think that by having the chat with the patient at the same time as you're doing something very important to his hand, I think it feeds back, it reduces his level of stress.
What do you have to do, you? What do you have to do, you?
My Baba is 8 months.
Oh.
And my eldest 8 years.
Oh.
And then 3 and 5. So a nice spread of them, yeah.
Oh, very good.
All girls.
Oh.
They're all girls, yeah. Blessed among women and all that. You know? So I'll be in big trouble later on in life. That hand was properly mangled with a chainsaw. There was so many little bits of skin poking out. Ultimately, we wouldn't have got a very good closure on the wounds. So he'll need more long-term definitive care under the hand surgeons, which is the plastic surgeons in our hospital.
Oh, all right, see you later. All right.
Good afternoon, CUHFM Hospital Radio, all day, every day, with your classics from the 60s and 70s and the 80s. Do you remember this guy, Harry Belafonte?
Hey, that's me. I'm good.
I'm Dave. I'll be taking upstairs there now.
That's good, Dave.
Tim has advanced lung cancer. Surgeon Kishore Dodakula is preparing for high-risk surgery to try and remove his tumour while also saving his lung. He won't know until after he has begun the procedure if that will be possible.
The most important thing is their life. And the second most important thing is get all the cancer out. Any operation, I suppose, done by a cardiothoracic surgeon is life-saving because the stakes are very high. If you take out the whole lung, the risk is as high as 1 in 10 won't make it. So the priorities are 3. 1, safety, so that his life is not in danger. Number 2, I want to get all the tumor out. And number 3, I want to leave behind as much of lung as possible so that he can have a good quality of life after this surgery.
Terrifying. One of the loneliest times of my life. I think I didn't want to be thinking about the reality of what could happen. And I didn't want to think of my life without Tim.
Okay to start, John.
I was terrified of the surgery. It was just all of the risks associated with just the surgery itself, outside of what they were trying to actually remove.
Okay, spread us, please.
I don't remember my life before Tim. I was separated. I didn't ever think I would meet somebody again, but Tim is the one. It's the only way I'll put it.
To see how we can negotiate this lobe and this lobe. Quartry, please.
2 hours into Tim's operation, Kishore has made his decision on what to remove.
Scissors, please. There is a tumor there. Sometimes lymph nodes are involved.
While James's pain has been brought under control, there is concern he could have severe damage to his chest and spine. A CT scan has been ordered to assess the damage.
And they gave you the ketamine. It wasn't pleasant to see the reaction, ketamine.
Why, well, was it bad?
It was just the way you reacted to it, which we were told is normal anyway. Your breathing, it was like you couldn't breathe, like you were starting to suffocate and your eyes just went completely wide and still. James is turning 50 this year and I'm 37. But once we got to know each other, it was never a question brought up between the two of us. It was evident very early on that things were going in one direction.
Your back is sore?
your upper back. We was coming up to Valentine's and he's just said, I hope himself is taking you out. And I said, no, there's no himself. So he asked me if I'd go out for a dinner with him on Valentine's. And of course I said yes. And we went to Bella Cafe in Fermoy, but we had to go to the foaling unit before we went for dinner. So I was introduced to horses straight away. Okay, don't worry.
He's very sore, very specific, one side of his chest.
We're going to get the scans done, okay? So Andrea's a porter. We're going to go down.
As you've been kicked and you see visible bruises on the chest wall, you don't see visible bruises in the lung. The consequences of that don't happen immediately.
Okay.
Then.
Yeah.
So we're just going to try and land you a tiny bit flatter.
Oh. Yeah.
How are you doing?
Yeah.
So this is going to go tight again.
Okay, thanks, nurse. That was in 7. Oh, yeah. Okay.
When James was wheeled away for the scan, it was then that I just broke down and I said, what is going on? What's going to happen? Is he going to be okay or not?
And then you take your glass off as well or into the next off the scan.
Take the belt off. Maybe that's just scan in the
It's all over, Tim. All right. It's all over. No, will we set you up, Tim? Would that help? Yeah.
Tim is in recovery following major lung surgery. Consultant Dervla Collins is on her way to brief Tim's partner Kay. The best outcome is that the cancer was removed and that Tim's lung was saved.
He was able to take out just the lobe. So do you remember?
Fantastic.
Yeah.
He didn't have to take the whole lung.
No, he didn't. Now,
Brilliant.
So he's left about 2/3 of the lung in, all right?
Fantastic.
And has taken, I suppose one of the lobes and a little bit of the top. But he's happy that he's got everything. Took out all the lymph nodes.
Thank you so much. I'd be just I'd be off with my tears again. That's my job. Yeah.
So they send that off now to the lab.
Okay.
Sometimes we see a little bit of cancer. I mean, we know the stuff worked. Because
Yes.
we know from the scans, we know that things looked much better.
Okay.
And so we're really happy with, I suppose, the result that we went to theatre with. And I suppose just take another 2 weeks before
that's
we
amazing.
get the full information about
I'm so relieved.
So I hope at least you're a little bit more
relieved.
at ease. Yeah.
Relieved.
Yeah, after I'm sure it was a very stressful day. Yeah.
Stressful months.
While it's good news that most of Tim's lung was left in place, there still remains a risk that not all the cancer was removed.
What we want is for when the pathologists look at that cancer that's being removed under the microscope, we want to see no cancer. We want to see that cancer having melted away with the chemotherapy and the immunotherapy, and that's the win.
When we were in the hospital and that we knew that it was a fracture to a rib and that his spine was okay, you have to look at the positives as well and see that he was okay at the end of it, but he was also extremely lucky to be okay at the end of it.
You get a second chance. Family is always going to be number one. The horses will be alright. But they're the hobby.
She likes to make funny noises.
I'm cancer free. Live healthy and happy. A lot to be said to be living healthy and happy. What more would you want?